In this video, we will learn how essential workers can help to keep kids safe during the COVID crisis. Recently, reports of child abuse and neglect in Missouri have dramatically declined. But unfortunately, that does not mean that child abuse has declined. In fact, in times of crisis and economic instability, child abuse rates increase. Currently, children are very isolated, which creates dangerous barriers for adults to report abuse and neglect. Children are not going to school, they're not going to their place of worship, participating in sports, and other public places where adults look after their safety. Kids are counting on the adults who see them and interact with them right now to keep them safe. So this video is for all of the courageous, hardworking people who are doing home deliveries, working in pharmacies, working in grocery stores, and other essential workers that are helping keep our communities running right now. We're going to learn the signs of abuse and neglect and where to report. There's a wonderful one-page resource that covers all the information that's going to be discussed in this video in the description below. You can download it and easily share it with the essential workers that you know. So the very first thing I would tell anyone who suspects child abuse and neglect is to trust your gut. If something doesn't look safe, doesn't sound safe, doesn't feel safe for a child, trust that. Trust your instincts, trust your gut, and if you reasonably suspect abuse, make a report. Now let's learn some signs that a child may not be safe. We've broken this down into 4 types of abuse: physical abuse, sexual abuse, emotional abuse, and neglect. For physical abuse, a child may appear frightened of the caregiver. They may have burns, bites, broken bones, bruising, black eye, complaints of pain. It's very common for children to have bruises on the bony parts of their bodies, their elbows and their knees, but not so much on the softer areas of their bodies, like their arms and their neck. Caregiver may offer no explanation of the child's injury, may blame the child. They might say something negative about the child, like the child is evil or so bad. In physical abuse, you want to ask yourself the question, does the injury match the story? Moving on to sexual abuse, a child may attach very quickly to strangers or new adults in their environment. They may demonstrate unusual or sophisticated sexual knowledge that is not age appropriate. They may have difficulty walking or sitting. If you witness a child being inappropriately touched, watching pornography, or you hear someone say sexually explicit things towards a child, these may be signs of child sexual abuse. Moving on to emotional abuse, a child may show extremes in behavior, so overly aggressive or overly compliant. They may appear emotionally distant, unattached from caregiver and others. A caregiver may consistently blame, belittle, berate a child, refuse to help the child when the child really needs them. And those may be signs of emotional abuse. The last type of abuse we'll cover today is neglect. So if a child is begging or stealing food, has very severe poor hygiene, or states that no one's at home to provide care, if you witness a child using alcohol or other types of drugs, if they are living in a very highly stressful family situation, and or adults in the home are abusing alcohol and other drugs, and if there's any unlocked weapons or guns in the home, those may be signs of neglect. So it can feel very scary to report abuse when you suspect it. And it's very common for reporters to feel like, this is none of my business, or this is a family issue. And they may start second-guessing themselves and second-guessing that gut instinct we talked about earlier. But please remember that when you are making a report, you are not making an accusation against someone. You are simply asking for a professional to come and help the child and the family. You don't need proof that abuse is happening. You need reasonable suspicion. And you may very well be the only person to speak up for that child at this time. In Missouri, anonymous reports are accepted from anyone. Anyone making a report in good faith is immune from any civil or criminal liability or any adverse employment action. Your identity is held confidential and will not be revealed to the family. Before we discuss where to report, I just want to thank all the essential workers for their bravery and their hard work. Thank you so much for taking care of us and our children at this time. In Missouri, you can report child abuse and neglect to the Child Abuse and Neglect Hotline. It is open 24 hours a day, 7 days a week. The number is 1-800-392-3738 or 1-844-CAN-TELL. If a child is in immediate danger, please dial 911. For a free child abuse and neglect reporter training, go to protectmokids.com. And for more information, you can go to MissouriKidsFirst.org. Thank you so much for watching. Let's pay extra attention to the children in our lives right now. They really need us. Please share this with all essential workers. Thank you.